Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Freshpaint, welcome and thank you for joining us for today's webinar. As healthcare marketers respond to the need to put privacy first, they are focusing on first-party data collection, which unlocks new tactics at every step of the patient journey. Today, we'll explore the critical role of first-party data in maintaining HIPAA compliance, controlling data sources, and preventing unauthorized sharing with third parties like Google or Meta. One note before we begin, attendees are participating in listen-only mode, but you can still ask questions. If you have a question, please enter it into the question and answer pane located on the bottom of your screen at any time. We will respond to as many questions as we can in the time that we have. With that, I'll turn the program over to our speaker, Mina. Ray is the Vice President of Marketing for Freshpaint, and we're happy to have him here. Welcome, Ray.
Yeah, thanks, Daniel. I appreciate that. Today I think what I want to have is a conversation with everyone. A lot of what we've heard over the last, gosh, it's been more than a year since HHS updated the guidance back in December of 2022 around web tracking technologies. There is a lot we've learned about what this guidance really means and about how people can navigate that guidance. But especially what I want to make this a conversation about today is that I would say a year ago it was panic. It was like, oh my gosh, what are we going to do? This is going to be a blocker for our ability to grow our business and do marketing the way that we've always done it. And I would say fast forward that to today, and what we've learned is this moment, while it's viewed as an obstacle, has actually become a strategic opportunity for a lot of organizations. So that's something that we'll spend some time going through. And then at the end, Daniel is going to be curating some questions. So the Q&A and the chat is open. So as we go through this, if there's questions you have, please put them there because we want to save time at the end to make sure that we can get into that and answer some of the specific questions that you have. As Daniel mentioned, I run marketing over at Freshpaint. Why is this relevant? I'm a marketer, just like many of the folks who are dealing with this HHS guidance and trying to drive high-performance marketing in healthcare. Full disclosure, I have no background in healthcare marketing. My background is in B2B SaaS. Where it becomes relevant is that in many of these startups, I've basically led marketing at 8 startups. I've used the exact same tools that healthcare marketers use. Google Analytics to measure performance and justify to my boss why I should continue to invest in certain campaigns. Different types of ad platforms like Google Ads and Facebook ads and programmatic advertising to drive acquisition and drive people through the funnel. I've tried all different bidding algorithms to get the most juice out of all those ad campaigns. So I do know a thing or two. And then the last year and a half, 2 years, I've spent working specifically with healthcare marketers to understand how can we navigate this and how can we find a pathway forward. So I want to start with like a little bit of a refresher because even for me, I've probably had about 300 conversations with healthcare organizations. This has been like a journey in really understanding where are the sticking points. And before we get into how do we think about this strategically, how do we move forward, I think it's really important to start back at square one, which is what did the guidance actually say? The HHS guidance, you can find it. It's HHS use of online tracking technologies. They have a whole big write-up on it. You've probably reviewed this with your in-house counsel or compliance team. If you haven't, you probably should sit down and make sure you both can get to the same understanding. We've had lots of conversations with those teams. We've even had conversations with external law firms that support healthcare organizations and their partners that oversee privacy. And what I think is one of the most confusing things about, and you might argue there's a lot of confusing things. I think some things are very clear, but one of the most confusing things that people are getting hung up on is in the guidance, HHS specifically calls out you can't share PHI with these web tracking technologies if there's no BAA that exists, no business associate agreement. What's confusing about it is there's two different cases. One is authenticated web page. The other is unauthenticated web page. Let's talk about the difference for a second. So before the guidance came in 2022, there was a general understanding that authenticated pages, logged in patients, logged in members, there's probably a trove of health information about that user, payments, scheduled appointments, things about their journey that is absolutely considered health context as far as HIPAA is concerned. In the authenticated world, this is not news. Like nobody was using web trackers in authenticated environments pre this guidance. Post guidance, what HHS was calling out that was new was that in some cases, unauthenticated your website, your homepage, a page on diabetes treatment where you're not dealing with a logged in user, it's just a visitor to the website, could also constitute an opportunity for PHI to be present and to be shared with web trackers. So the guidance was very, very specific. If you read the guidance in the first 2 pages, there are 2 blocks, and I've linked to it here. We'll make sure to share this with everyone as a follow-up. There are 2 blocks of text, one that speaks specifically to authenticated users and one that speaks specifically to unauthenticated users. The authenticated users, because HHS assumes everything about that authenticated experience is health context, that sharing anything back with a web tracker, like an IP address or something like that, any kind of ID, address, email address, would be PHI. And because of that block of text, a lot of legal teams are saying, oh my gosh, an IP address is PHI. Yes, in an authenticated environment. Now, let's look at the other side of the equation, which is your website, your homepage. That's an unauthenticated website. In that case, HHS believes, and they've written this in the text, that those web trackers may not have access to PHI. Where they would have access to PHI is if that page has information that relates to the individual's healthcare, scheduled appointments, previous healthcare, looking for a specific condition, looking for a specific, find a doctor. When you have that context plus IP address, that's when you potentially have PHI. So a lot of the conversations we're hearing is like, we hear legal teams say IP address by itself is considered PHI. If you read the guidance very, very specifically, yes, on authenticated pages, not necessarily on unauthenticated pages. So what does that mean? So most of our conversation today is going to be about unauthenticated pages, your website, right? This is not a logged in user. You're doing marketing, you're running campaigns, you're driving people to your site to try to get them to become patients. That entire experience until they log in is an unauthenticated experience. What HHS is very, 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 very clear in their guidance is that you have to have a combination of 2 things for this to be considered PHI at all. So the first piece is you have to have one of the HIPAA identifiers. So things like IP address, obvious stuff like name and email and address and phone number, those are all considered HIPAA identifiers. They're data points that could trace back and say, this is Ray or this is Daniel. That by itself in an unauthenticated environment is not PHI. What you also have to have present is you have to have some health context about that individual's health journey. And HHS gives a bunch of specific examples of what that could look like. They could look at a condition-specific page. They could schedule an appointment. They could use one of these really nice find a doctor portals to look for an orthopedic surgeon for a meniscus repair. When you combine the two, when you combine the context of their journey plus the identifier, now you have protected health information. You have context about an individual's health journey. Let's contrast that with you have an IP address on a page on your healthcare website that is like job openings. So you're advertising job openings for janitorial services and doctors and nurses. Does that page contain health information about a visitor's journey? No, probably not. So an IP address on that page would not be considered PHI. So the last piece of this equation is there are a bunch of tools, which we're going to get into today, where it would be okay to send PHI if you have the right legal framework in place. The right legal framework in place when we talk about that today is called a business associate agreement. You get a BAA signed with any organization you're working with that you would share this combination of health context and identifiers with. If you have that in place, HHS is still saying it's okay to share PHI with. It can be okay. What we're talking about is a whole ecosystem of tools that do not sign BAAs and will never sign BAAs. So sending a combination of identifier plus health context to a downstream tool where a BAA doesn't exist, that is exactly what HHS has called out about HIPAA issues on unauthenticated pages. So how does this work? So the risk here is that you have an ecosystem of tools in healthcare, and we have several hundred customers that utilize Freshpaint. They almost universally are using tools like Google Analytics to measure results, different types of ad platforms like Google Ads and Facebook ads to try to acquire new patients or try to drive those visitors to view certain types of content. And then they use tools to improve experience, like embedding videos on a healthcare website to help people understand an upcoming treatment, or embedding maps to help people find different clinics. The tracking technology actually loads on your website, on your healthcare website. And when a client, a visitor comes to that website, it loads on their machine and it suddenly has access to a whole bunch of information, like IP address, like device ID, like form fill information, plus all the health context. What pages did they visit? Did they go to a find a doctor page? And it can feed that data directly down to those tools. And this tracking technology that sits in the middle explicitly is what HHS has called out in the guidance as highly problematic. And so what are the risks? Like now it's no longer theoretical. We've been able to see over the course of a little bit over a year what these risks are as they've unfolded. Surely HHS has updated their guidance, and there's a risk of violating HIPAA, and there's some things that come along with that, like your CISO can end up on the wall of shame because there's been a PHI leak, which could be a career limiting move for anybody who's in, the information side of the house. But even more of a risk is that lawyers now have become activated. It's quite easy for lawyers to run a site scan and look at your website. And just going back to this image, they can quickly see with a bunch of free tools, do you have any of these trackers that have caused problems in the past running on your site? And when they find that and they find former patients, basically then they can open up class action lawsuits. And there have been countless. Each week, we hear of large healthcare systems, major insurance companies, small regional hospitals, small health tech companies getting sued by lawyers, which costs a lot of money to defend, creates PR nightmares, and just invites all kinds of future calamity within an organization. In addition to that, we've seen a group of the government that is not HHS, the FTC. They've weighed in using wiretapping laws and Video Protection Act to basically come after healthcare organizations to protect consumer privacy. So you've got like these three different edges of the sword, class action lawsuits, FTC, HHS. And then the fourth piece that we're seeing is just consumers are frustrated. Consumers don't want to be tracked online. Consumers have been very vocal about, wanting to have their privacy protected. So there's a whole bunch of reasons now healthcare organizations have decided, let's lead from the front. Let's find a way to actually keep doing what we need to do, but let's mitigate this privacy concern. And the good news is we'll talk about today that there are a number of ways to do that. So just to like connect all the dots, it's really, really easy for you. You may be using a bunch of web trackers on your healthcare website that feel pretty innocuous, but those trackers out of the box are designed to literally load on the visitor's machine, and they automatically collect these data points every time. So they collect device ID, that's considered a HIPAA identifier. That's also what basically reconcile a visitor as they visit different pages or they come back to your site multiple times. They collect IP address, which by itself is a HIPAA identifier, but is also used by a lot of these platforms to find very precise geolocation, which HIPAA also calls as an identifier. If they know that you live in a certain zip code and you have a certain condition, that could be enough to determine, who this person is and what their health information is. And then finally, there's all this contextual information about our visits. So when we go to these websites and we view pages and we fill out forms, those trackers by default are capturing this information. So just even having page visit URL information, if it's a diabetes type 2 blog post, or it's an orthopedic, find a doctor lookup page, or it's directions to a specific location, that could be context about that health journey. The web trackers are doing this automatically out of the box. That's just how they work today. And what are these web trackers? They all work a little bit differently. So like ad platforms, for example, if you have Google Ads, you want to feed back data to Google Ads to optimize for conversions, to measure conversions. And those Google ad trackers out of the box, and Meta ad trackers, and if you're using X or any of these other adjacent platforms, they are collecting all that information I just shared with you. Same with Google Analytics. You go to Google Analytics and you build reports. You can build funnels. You can see that people visited these 5 pages before they converted. What you don't see is that Google Analytics is also collecting a bunch of information that identifies that visitor. Even though I use Google Analytics every day, I cannot see who visited my site. I just see an aggregate that 15 people visited this page on how does Freshpaint help in healthcare, but Google knows who it is. Google has all that unique data. We're also seeing other tools now that organizations are getting pretty alarmed about. So a lot of organizations host videos, they upload them to a platform like YouTube, right? And if you ever uploaded a video to YouTube, you can see that immediately YouTube creates a transcript of that video. What does that mean? It means they know the context of the video. And if that video is about an upcoming treatment or something specific to a condition, that could be considered health context. When you embed that video using a player on your healthcare website, you're trying to just improve the experience of the visitor. But when that visitor goes to that video and clicks play on it, it shares the IP address of that visitor. So once again, you have a platform that doesn't sign a BAA with context about the video, collecting identifiable information about the visitor. That's also considered potential PHI risk. Embedded maps did the same thing, like something as innocuous as embedding a map onto your website to help create like, where do I go? Where's my appointment today? That map being embedded on the website shares the location, so that orthopedic clinic, and it shares the visitor's IP address. Once again, health context and the identifier side by side. This is a big risk point. So this is not just an analytics problem. It's not just an ad problem. This is about web trackers that exist across the entire healthcare website. So let's shift gears and talk a little bit about the path forward. Like how would we start to address this? So the first part, and I'm actually really surprised at the number of organizations that I've talked to who haven't really exhaustively done this first part. This first part has nothing to do with buying any technology. It has nothing to do with like hiring engineers to solve anything. This is really about auditing the website. So there's a bunch of free tools that are out there. Freshpaint has a web tracker monitor tool as well, but there's a bunch of ways you could do this. You could have your IT department do this. You first need to create an inventory. What are all the web trackers that are on across your site and across your domains? Like just create that inventory. It doesn't mean that all of them are going to be problematic, but you need to first understand which ones are installed and where are they installed. The second part of that is to figure out which ones are problematic at all is, are they installed on pages that could contain health context across your website? So I used the example of the job posting page. That may not be health context in your organization. So if you have web trackers there, that may be perfectly fine because it's not sharing any PHI about any potential future patient. But you have to do that analysis first. You have to figure out, is this web tracker on a page that could contain health context? So the final part there is then that still might be okay. Like imagine that you have a web tracker on a page that does have PHI possibilities, but then the tool that web tracker is feeding has a supported business associate agreement. So a lot of healthcare marketers use, and we're going to get into some of these tools in a second, but a lot of healthcare marketers use a call tracking tool like Invoca, right? Invoca puts web trackers on your website. But Invoca also signs a BAA with their healthcare customers. So that would be one where once you do this analysis, you say, oh, it is sharing PHI, but we have a BAA with Invoca. We're okay to do that. So it's this audit, analyze, and then verify if it's okay to share PHI to this tool. This first three-step here, this is actually a new process that you have to implement. And it's a combination of marketing, IT, legal, and compliance. You'd have multiple stakeholders that have to actually do this analysis together and make the, draw the conclusion. Like your legal team is a critical stakeholder here in determining if they believe that PHI is being shared on this page or not. Do we have the right legal framework in place? Once you've done this part, you're basically going to end up with, I'm going to oversimplify, but you're going to end up with two buckets of tools. You're going to have tools that it's okay to share PHI because you have a BAA, and you're going to end up with buckets of tools that you're never going to get a BAA, and it's not okay to share PHI, and you're going to have to do something about. And that's the govern phase. Like you're going to need to figure out a way, like continuing to utilize native tracking pixels from like Meta and Google Analytics and Google Ads, and even for like YouTube, that's going to be super problematic. Your website is constantly going to be a signpost for lawyers to come dig a little bit deeper or regulators to dig deeper. So you're going to need some way to govern that flow of data and make sure that PHI doesn't get to any of those tools. And then the last piece is, it's not a set it, forget it. We have a bunch of customers who have gotten their website to a clean slate. And because they're working with multiple marketing agencies, somebody just installs a new pixel on the site that they weren't aware of. And now that pixel is sharing PHI with a tool that's not compliant. So you're going to need some way to monitor this on an ongoing basis to identify new pixels that might get installed that could put you at future risk. So don't just do the first four and then walk away. Make sure that you have a team of stakeholders that's constantly engaged here, and make sure you have a source of truth so you can make sure that that each pixel has been audited and like where you stand with each one. So that's the first part is you need some kind of web tracking tool. And ideally, you want a web tracking tool that's built for HIPAA. You want something that actually can give you context about if do we think this tracker shares PHI and doesn't support a BAA? Things to help you triangulate on the pixels that are going to be at highest risk. You're also going to want to have some source of truth. So like some people are creating a spreadsheet offline. I've audited these 100 trackers and this is where we stand. Even better if there's some tooling you can use where you're monitoring and then managing those trackers, so you don't have to keep redoing it. Or worst case scenario, you do get sued. You want to make sure that you actually have that source of truth that your legal team and your marketing team can support to show that like you've done your due diligence and you've done your work to shore up on the privacy side. And this is what I mentioned before, when you go through this journey and you do this audit and you start to find these two buckets of tools, you're going to find this bucket of tools where a BAA is required, right? So let's talk about that for a second. So the BAA required means if you are using, let's say I'm a marketer and part of my goal this year is not only do I want to acquire new patients, but I want to take an active role in engaging those patients through their journey. And so what I mean by that is that it's more than just reminding them of an appointment. It's like making sure that we help them have a better healthcare experience and ultimately come back for additional services to improve the lifetime value of that patient. This is where tools like CRMs and engagement platforms are really powerful, because we can collect a bunch of information about that patient's journey and we can send them the right message at the right time. Like, oh, we know that like a year from today is the next time that they need to come in for their wellness exam. And we want to make sure that leading up to that over 3 months, we kind of like tease that out and make sure to give them guidance and useful information about that upcoming visit. An engagement platform, in order for it to work, if you want to message me as a patient, and I get these all the time. I have a healthcare provider and I get these messages. So they have my email. they have my phone to text me, they have my name, and they also have all this information, about my journey. Like, what have I done in the past? When have my appointments been? When is my next appointment? All of that is PHI. That's identifiers plus health context. We have healthcare organizations that are trying to use engagement platforms and CRMs that won't sign a BAA, and they're asking us how can we make those tools safe? You cannot, you cannot use a CRM or an engagement platform that will not sign a BA. There's no way to de-identify the data. There's no way to remove the help. It won't work. Like, those tools will no longer be CRM or engagement platforms without both components. People use data warehouses all the time to ingest a lot of information about their visitors and patients to do a more granular analysis. So maybe they want to go all the way down to geo, like what geo locations are my ads working the best, because I might want to maximize ad spend there, or I might want to try different techniques or personalization techniques in those areas. People will send a huge data set to a warehouse so they can do that analysis. In that data set, potentially will be PHI. So to utilize a data warehouse as a source of truth, you want to make sure a BA is there so that you can send that full data set. A lot of healthcare organizations that I've talked to so far this year, one of the biggest missions they have is to start cracking the code on improving personalization. So there's all these digital experience platforms like Sitecore and Chameleon that can personalize an individual's experience when they come back to a website or they come back to their patient portal. If you're going to personalize for someone, you're going to have context. Therefore, you're going to need some kind of BAA. So there's this whole subset of tools that if you're using today and you do not have a BAA, you should be pretty alarmed, and you should start figuring out how you can get a BAA signed with that organization, or you should start looking at tools that will sign a BAA. On the bottom of this image, you have a bunch of tools that just don't sign BAs. Like, you should think of the entire ad ecosystem, the entire Facebook ecosystem, the entire Google ecosystem. Outside of Google's BigQuery on the data warehouse side, Google does not sign BAs for their analytics or ads tools or their YouTube or embedded maps. And so you're gonna have to accept that those tools will never sign a BAA, and you're gonna need some way to govern the data. You're gonna need some way to ensure that the combination of identifier plus health context is never shared with those tools. And the first step here is and this is the shift from third-party data, where you have these native trackers installed on the website that freely collect whatever data they want and ship it off to Google and Facebook. You're going to have to shift to a world where you remove those native trackers and you utilize some type of tracking technology that turns your data into first-party data. And that tracking technology, that platform that you invest in, is going to need to be BA supported. Like, you're going to need to make sure it's okay to collect that data in the first place. And then second, you're going to need a way to govern that data. You're going to need a way to make sure that you govern the flow of data so that PHI is never shared with downstream tools. And that's a critical step, because the first step of removing those native third-party trackers, it removes the biggest part of the compliance risk, because now when lawyers do site scans, or if a regulator does a site scan, they don't see the metapixel. They don't see the Google tracking technology. They don't see embedded maps on your site. That's the first step. The second step that becomes really strategic here is now, instead of third-party data that's owned by Google and Facebook, it's your data and your customers' data. And you can start to use that data in some of these other tools that we've called out, like engagement platforms, to improve a better experience and really help your patients have a better journey, through your brand. So, and this is what I've been talking about. This is the ideal state, is that these personal data, user data vacuums that are the ad ecosystem, if you remove those third-party trackers and you utilize some tool like Freshpaint to collect it and govern it instead, you cut off the flow of this PHI and this information to those server farms. You get to decide what is okay to send to Google Analytics, what is okay to send to YouTube, what is okay to send to Google Ads. That's not the current state. If you're using native trackers, you don't get to decide. They are going to try to collect as much information as they possibly can because it feeds their ad business. You know, they're both combined. Google and Facebook are $250 billion a year ad businesses. They're so valuable because their targeting is so incredible. And it's because every time someone installs that pixel on a business website, it gives them unfettered access to all of the data about the consumers visiting that page. Even if they're not using it to your benefit, they're just using it to their benefit for future ad performance. So this is the first step is you just need to move to this world where those native pixels no longer exist. And the second piece is like the governance, right? Like it's one thing to be able to collect the data safely. It's the second, can you control the flow of data? Because even if you use a tool that can safely, that signs a BAA, can replace native pixels and can safely collect the data, how are you going to safely share it to these downstream tools like Facebook ads, Google Analytics, Google ads? That's the whole point. Like you need that feedback loop. You need to share that with downstream destinations to make those tools work effectively. And in this context, you're going to need some control. And you have a couple options. So there are tools that exist on the market where you can, if you have a big engineering team, engineers can manually build filters and manually edit the metadata to make sure that specific health contexts or identifiers never get shared with these tools. Or you can look into tools that have a UI-based approach, a tool set that by default doesn't share any data with these destinations and allows you visually to control what data will be shared. And as an example of like how that could work is in advertising, the way that ad platforms work today is they've all shifted to this world away from manual bidding to automated bidding. So ad platforms are real, and I started here on like literally cost per click bidding, where you would bid, if anyone's here remembers these days, you would bid on the cost of a keyword to be able to serve your ads. It doesn't really work that way anymore. You bid on conversions. Like if I'm a healthcare provider and I'm trying to drive scheduled appointments to my clinics, I don't care about clicks. I care about scheduled appointments. And Google and Facebook have gotten so good at allowing me to optimize for that outcome that you no longer bid manually on each keyword, or you don't bid on the clicks. And in order for that to work, though, you need to feed a minimum data set back to these ad platforms. Like they need to know that a conversion happened and they need to know who converted, because then they use that seed audience in their platforms behind the scenes to improve their targeting for future ads to be served. If you use the native pixel, it's sharing too much. If you remove any data flow at all, this optimized conversion bidding algorithm won't work at all. It has no data to like anchor off of, and your lead costs and your customer acquisition costs will go through the roof. We've seen it go up by as much as 8x from some of our customers. But the way you could do this and still meet the privacy standards while driving high performance marketing is you limit the data set in a way that doesn't share PHI. So in ad platforms, I just said, like, you need to have a conversion and you need to know who converted. So you know there's going to be an identifier. Therefore, you can never share any context, meaning has to be a generic conversion, like a lead. You can't share that they scheduled an appointment, can't share that they read this blog post. You can't share that they like visited a doctor page. You just share a generic conversion like lead. And you share the ad click ID, which originates in the ad platform that's not covered by HIPAA. If you share those two pieces of data, these ad tools can still work effectively and optimize for future conversions. And in this context, in this recipe, remember HIPAA identifier plus health context. There's no health context. They've been completely cut off from this visitor's journey through your website. They don't know what pages were visited. They don't know what forms were filled. They don't have any of that context, and therefore they're not sharing PHI with those platforms. On the analytics side, it's a little bit different because if you've ever used Google Analytics, which I'm guessing most people on this call have, you build reports based on the journey. So you can see pages that people visited. You can see which pages are they converting on. there's a lot of health context, like the page URL of that diabetes type 2 treatment page could be considered, specific health information, or a find a doctor page could be considered specific health information. In that context, Google Analytics is going to receive all this data. So you can never share with Google Analytics any identifiers. You have to be able to make sure that they don't ever get an IP address, they don't ever get a device ID. And in this formula, if they're only getting health context page visits and they're not getting identifiers, once again, you're no longer sharing PHI because you don't have that recipe of identifier plus health context. When we start to think about each tool, it behaves a little differently. If you think about embedded maps, for example, embedding a map on your website shares context about where the patient might be going, where the visitor might be going, and it shares their IP address. So you need a way to make sure that IP address can no longer be shared to something like Google. It's the same with YouTube. So if you host a video on YouTube that has context about health and you have a YouTube player on your site, it's sharing the IP address. You need a way to block that IP address from getting over to YouTube so you never share PHI. So there's tooling that's about, you can build it yourself. You can basically hire some engineers to go build and manage this stuff on an ongoing basis. Or you can look for a new list of tool sets like healthcare privacy platforms that have all these use cases built into them that out of the box allow you to make these changes very quickly alongside your legal and compliance team and control this flow of data so that all of those tools in your stack still perform in the way you expect, but actually no longer share PHI. So the strategic opportunity here is that data set that you're collecting. Now you own the data. It's your customers' data, it's your patients' data, it's your visitors' data, but it's shared by you. It's no longer owned by Facebook or Google or these other tools. And you get to control that flow of data to optimize for your performance. But then you have that data set to utilize in future campaigns and tools. So if you want to launch engagement campaigns, you have the complete data set to use. If you want to do more granular analysis using some BI tools, you have the data set to use. Versus today, where if that data is being collected by a third-party tracker, that's just being shipped off to Google. You don't necessarily even have full access to that data today. So I'll pause there because we definitely wanted to save time for Q&A and make sure that we got into some of the questions from everybody who's been gracious enough to attend and stay throughout. There's never enough time to get through every single question on these things, and I thought this would be a good time to call out some other opportunities for us to connect in real life. So Freshpaint is going to be participating at HIMSS coming up on April 17th and 19th in Las Vegas. So if anybody is planning on attending that conference, we're going to be at booth 39. So please come by and say hi. We're doing a special session with one of our customers, Mike Soros, who's the director of digital strategy at Heartland Dental, which is the biggest DSO in the country. He's going to talk specifically with us about how he has balanced high performance marketing and HIPAA compliance. And he's going to talk about how this actually has been a strategic opportunity for him, where they've been able to not only shore up the privacy side, but they've been able to level up their performance. Like, it's shocking how much better their advertising performance is now after making changes in their tooling. So great example of how this isn't an obstacle, that this could be a strategic opportunity to improve things. And then we're doing a really cool Freshpaint live event at the T-Mobile Arena. It's NHL Hockey Night. We have a special suite in the Stella Artois suite. So please register at freshpaint.io/HMPS24 if you're interested in connecting. I promise you there'll be lots of other healthcare organizations and marketing leaders where you'll be able to share with your peers and kind of learn some of the ways that they're navigating this. And they're always going to be even better at answering your questions than I will be, or any other potential vendor. So yeah, hope that we can meet you there at the upcoming event. I think it's going to be a fantastic conference, and I know people are excited to get back to some of these events in real life. So wanted to give you a couple of options. Daniel, I know that we wanted to save some time for Q&A, so want to turn it back over to you and see what questions we have from folks.
Great. Thank you, Ray. We do have some questions coming in and a few that were submitted beforehand. And as a reminder to those that are here with us, if you have a question, you can ask it in the question and answer pane on the bottom of your screen. I'll start with one that came in during the presentation. I think you touched on it a little bit, but maybe a little bit of a deeper dive. It's can one BAA between a marketing agency and the healthcare organization cover numerous web trackers, Meta, Google, etc., or does the healthcare organization need a BAA with each media platform?
Well, you can't get BAs with the platforms. Like if we're talking specifically about advertising platforms like Meta or Google or even programmatic advertising platforms like StackAdapt, you just can't get a BAA. They won't sign it. So why won't they sign one? The reason they don't want to sign one is because their whole advertising model is predicated on being able to capture as much consumer information as possible so that they can improve their targeting. It's $250 billion worth of targeting a year. It's like the most successful advertising businesses ever created in the history of the world. And so they don't want to signal to the market that they would be willing to throttle that collection of data in any way. So there is just no scenario for you to get a BAA with any of these advertising platforms. Now, I'll take the question a step further in that there may be some tooling where you're working with your agency partner and your agency partner has a license to utilize that tooling. This is something you want to vet with your internal legal team. But if that tooling is supported by a BAA and your agency partner has signed a BAA with that tooling, and you have a BAA with your agency partner, depending on the language in the BAA, you might be perfectly fine in that scenario. But I just want to make clear that many of the tools in the ad ecosystem, whether it's through your agency partner or there's just no way for you to get a BA with these tools.
Great, thank you. Following up on that, are you aware of any QR code services willing to sign BAAs?
My gosh, I've never looked into that. I don't know, but you can bet I'll go do some Googling later today. It's the first time I've heard anyone ask that.
All right, great. We'll follow up with you afterwards. Does Freshpaint include or cover YouTube, embedded video, and even embedded maps?
We do. We do. The raging use cases early on were Google Analytics and all the ad ecosystem, which is still our bread and butter. We make sure all of those can still perform in the way that you expect and also make sure they don't get PHI. But we've also added support for a growing number of use cases, and YouTube is one. Oversimplifying it, we just make sure YouTube never gets the IP address of any of the visitors that interact with the videos on your site. And with maps, instead of using Google Maps, which will definitely, if you have embedded Google Maps on your website, on your healthcare website, and those embedded Google Maps are pointing to locations that are, healthcare practices or clinics or oncology, MRI facilities, that embedded map, as soon as the visitor hits your page, their IP address is shared. So they have context about future healthcare plus the identifier. Once again, in this case, we actually have our own proprietary mapping solution. We recommend not using Google at all in this case. And therefore, no IP address or no data is ever shared out of Freshpaint's BA supported platform.
Terrific. This has been great for those folks that are sort of a little bit further along in the process, but if maybe we could take a step back. You have any advice for organizations struggling to get internal alignment behind this approach?
Yeah, Thanks for that. That's a really great, whoever asked that's a really great question. The first thing is that this is what we've seen universally is that marketing has inherited this problem because marketing, I'm VP of marketing. I own the website at Freshpaint. I've owned the website at every startup I've ever been a part of. Most of my counterparts in healthcare marketing, they own the website, and that's where the web trackers exist. And so marketing has assumed responsibility here to get to a clean slate and manage that going forward. But you can't do it alone. So we've seen typically three major stakeholders. It's legal for sure. Legal has a stake in this as well. IT, because in many cases, IT is the one that can actually add or remove web trackers from the site. And I would say that the very first step here is, be proactive and have a meeting with those if nothing is happening today, there's no harm in you doing the audit part. If you do nothing else and you at least gain an understanding of where the risk lies, this is a risk mitigation exercise. You may decide that you don't want to do anything. You're going to continue to run status quo and you're willing to take the risk because you need to for your business to grow. That's an internal decision that can be made. Or you may decide that like the risk is too high, we're not going to do anything. But doing the audit with legal and IT just to get an understanding of where the risk points lie and how your organization thinks about risk, this will help prevent you from being blindsided. And what I mean by that is that there's one viewpoint, which is me as a marketer, I get it. Like I don't want to tell anyone anything because I don't want to I don't want to get disrupted. I need to measure my performance. I need to run ads in these channels, like 100% correct. And so I don't want to raise this concern because I don't want someone to shut me down. But the reality is, like, if you get sued, which eventually is likely to happen if these web trackers are on your site, then you are going to get blindsided. Like legal's going to come in and tell you to put pause on a whole bunch of stuff, most likely. So it's better to like get in front of that, do the audit together, get to an understanding of what trackers are putting you at risk, why are they putting you at risk, what's our risk tolerance here, what are some backup plans in case in case we have to make a decision. I would just take that proactive approach, buy coffee and lunch for your legal counterparts, build a good relationship there. And every organization that's been able to navigate this successfully, they've all been able to have like a great thought partnership with their legal and IT counterparts. And it's not always easy. It takes time because both parties are coming from a different place of understanding. And there's a level setting of knowledge. Like your legal counterpart has a whole bunch of legal concerns that don't relate to your website at all. And they don't necessarily understand how any of these tools work or why you even need to use them. So getting to that baseline of understanding is a fantastic starting point. And again, helps you de-risk the possibility of like just being blindsided, by legal telling you to shut things off.
Yeah, that's great. So now that we've gotten our internal buy-in as an organization and we're switching to first party collection, how do we now signal to the important folks out there, our audience and our customers, that they can trust us and that this is transparent?
Yeah, this is an interesting one because a lot of decisions so far, at least initially, a lot of decisions are being made around the risk of regulators or lawyers. Like people don't want to get sued. That can be extremely expensive to defend that stuff and has, PR downsides. And then if regulators come, like we've seen cases where the regulators have FTC as part of the agreement have forced the healthcare advertiser to not be able to utilize like Facebook or Google ads at all. So, if you're spending any kind of money on those platforms and you suddenly were told by regulators you can't use them anymore, that's a heck of a pivot. That's really hard. But what we're seeing more now is people are starting to realize that ultimately this is being driven by consumers, that consumers, more than almost any other brand, consumers trust healthcare brands. Like, I mean, I genuinely say when I say this, I mean it. Like when I think of all the brands, like Uber, Nike, whoever that I don't trust those brands. I might just like certain aspects of them. But when I go to my local hospital or healthcare provider, I'm going there because I trust that they're really looking out for me and they're gonna take care of my well-being. And that starts to apply to the online world as well. So I think there's a strategic opportunity, and I think this way because I've seen organizations take this approach of just being really proactive and letting their consumers know that they really care about their online privacy and disclosing what they're doing about that. So, you could be very public about not utilizing any native advertising trackers on your website because you want to make sure that those tools don't receive access to information that might be sensitive. That could be that's obviously an internal discussion with your comms team and your legal team, but that could be a strategic opportunity that a lot of other organizations might not be taking right now. So I think I would start to think about this beyond the regulators and beyond the lawyers and think about why does this really matter to our patients and, the trust that we build inside the four walls of the hospital or clinic, how do we extend that out to the website?
All right, great, thank you. I want to get to a question that we have asked live here, a little callback to the YouTube. If a visitor signed into YouTube already when they activate an embedded video on a healthcare site, will that also identify the user even if the IP isn't tracked or captured?
So this gets nuanced. So there's two pieces to this. So, and apply this to any of these tools. So Facebook is a social media platform. Ray as a user could be on Facebook, browsing my newsfeed and interacting with things, including ads from your healthcare organization. Ray as a user could be in YouTube, on the YouTube platform, browsing, interacting with videos uploaded to YouTube, including videos your healthcare organization has uploaded about health procedures or surgeries, whatever. Those platforms are not covered by HIPAA. So if Ray as a user goes to Facebook or YouTube, those platforms by themselves they're not covered entities. They're not covered by HIPAA today. So any of the actions I take, even interacting with things that you've uploaded to those platforms, that is not a HIPAA concern today. The concern comes from how does it relate to your website? So the YouTube video uploaded to YouTube by itself is not a problem. The problem is you just put an embedded player on your website. And on the website, I interact with that embedded player that accesses a video hosted on YouTube, IP address of the visitor connected to context in the video from your website. It's from your website that really starts to trigger this stuff. That becomes an issue. If a user is logged into YouTube and they interact with a video on your website and IP address is not shared, then YouTube has no access to that user. So that's not the way the player would work today. So you would still be okay. Your biggest concern is going to be, are you sharing any information from that player that's embedded on your website? So in the context that you described it, I'm probably logged into YouTube right now on my browser. If I go to your healthcare website and I interact on your website, I interact with a video about my upcoming meniscus repair procedure, and no IP address is shared back to YouTube. There's no way to link. There's no way to link me as that anonymous visitor to me on my web browser somewhere else logged in.
All right, thank you. I think we've got time here for one last question. So what should we as marketers expect to change from the way we've been working once we move to a privacy first approach?
Yeah. I think the biggest change is that you're making, right now, if you put a native web tracker, there's not a lot of decisions around what data gets shared because again, you don't have control. The native web tracker, the meta pixel is going to take what it can get as much as it can get. In this new world, you are, as we've talked about, like you're going to replace that native pixel with a first party technology that you get to control what data is shared to those downstream tools like Meta or like Google Analytics. The biggest change is that you're going to need to have that tight collaboration with your legal and compliance team to make sure that everybody is on the same page about what is getting shared with each tool. What is that complete data set? Verifying that indeed only that data set is being shared, monitoring that on an ongoing basis. That's going to be change number one. Change number two is that, as I've said before, this should not be considered a set it, forget it exercise. I think the mitigation of risk is pointless if you do it once and then walk away. You're going to need to implement some way to monitor and manage web trackers on an ongoing basis. So once again, you don't get blindsided. I'll say it again. We've heard countless cases where people get to a clean slate, and because multiple organizations may have access to installing web trackers on their website, suddenly there's like 3 or 4 new web trackers that are potentially like sharing PHI with tools that don't have a BAA that weren't there a week ago. So those are going to be, that tight collaboration with legal about what's okay to share with what tool, and then what's going to be the process that you put in place on how you stay on top of the web trackers that are installed and monitor for the ones that are potentially getting installed right now.
Okay, terrific. Thank you, Ray. I'm
Absolutely.
sure the audience joins me in thanking you for sharing your expertise on this important topic for healthcare marketers. Thanks also to all of you in our audience for carving out time to join us for today's program. We've come to the end of our time, but please note that if you've asked a question we weren't able to get to, we'll do our best to get you a response as soon as possible. The forum will also be sending out a link to the webinar recording in the next few days, so please be on the lookout for that. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. We look forward to seeing you at future webinars and, of course, at the Healthcare Marketing and Physician Strategy Summit, April 17th to 19th in Las Vegas. Check the forum website, healthcarestrategy.com, for more details. That concludes today's program. Thank you and have a great day.
Thanks, everyone. Really nice, Daniel. Thanks so much.